September is also observed as the Gynecological Cancer Awareness Month. There are many cancers which fall under the subgroup of gynecological cancers. These include the cancers of the ovary, the cancers of the uterus, cancers of cervix, vagina, and vulva. I will be speaking a bit more about cervical cancers because cervical cancer is the second most common cancer the women in our country are exposed to. Worldwide, if 5.4 lakh women get cervical cancer, almost 97,000 women belong to India, which is a huge number, and it is very, very deplorable as well for the fact that this is one cancer which is preventable and we can pick it up in a very early stage even before it develops. So it is important to learn about it. Cervical cancer is primarily associated with exposure to a virus which is called human papillomavirus. Human papillomavirus has multiple strains which are afflicting the cervix and causing cancer. Before the cancer develops, it causes certain changes in the cervix which are called cervical intraepithelial neoplasia. These are the changes which can be picked up by simple tests like pap smear. If a woman is going for a regular pap smear, it is quite possible that these changes will be picked up, and before the cancer develops, it can be cured. The other things which are associated with cervical cancer are multiple childbirths, a poor hygiene of the genital area, smoking and alcohol consumption, consumption of diethylstilbestrol in a mother who is carrying a daughter in her womb can lead to a clear cell carcinoma of the cervix and vagina in the daughter. So these are the commonest factors which are associated with cervical cancer. Symptoms include intermenstrual bleeding during sexual intercourse, foul-smelling discharge from the vagina, backache, swelling in the legs, weight loss are usually representing advanced stage of cervical cancer. So what can we do to prevent cervical cancer? First and the foremost is the vaccination. And I'm speaking a little bit more on the cervical vaccination in my next video. Apart from vaccination, the other things which are important is the screening. Screening is conduct of a regular pap smear, that is the examination of the fluid which is around the cervix. It should be started within 3 years of commencement of sexual activity, and it should be repeated every 3 years till the age of 65 years if it is normal. In case it has also been done along with another test called the HPV DNA and it is normal, then the frequency can be increased to every 5 years. So this one test is something which reduces the chances of missing out on cervical cancer and also gives an opportunity of treating many other conditions in the cervix before they actually go on to develop into cancer. So do watch the next video on the vaccination for cervical cancer.